and ways to protect your family's health. Srilata Ajarapu is the health education specialist for the Santa Clara County Childhood Lead Poisoning Prevention Program. And I will also be presenting on the state's outreach efforts and family prevention strategies. At the end of the presentation, our presenters will be available for questions, and a recording of the presentation will be available on our website, which is listed on the right-hand side of the screen. And recordings from the other presentations from this week will also be posted on the site. So with that, I will hand it over to Srilata to begin the presentation. Thank you.
Thank you, Jessica. Good morning, everyone. Can you all hear me okay? Yeah, okay, thank you. So welcome everyone to the final session of this webinar series. Thank you all for joining us. As Jessica said, today I will be discussing the various outreach initiatives undertaken by the Childhood Lead Poisoning Prevention Program, also known as CLPPP in Santa Clara County. But before I go into those specifics, just to give you a little background, let me share a little bit about my role, my team, and our responsibilities. My primary role as a health education specialist, it involves community outreach and education. We work to raise awareness among various segments of community, including parents, families, healthcare providers, childcare providers, and general community members across Santa Clara County. Our approach also entails partnering with other organizations and programs, actively participating in their events to engage with the wider community. Our team is committed to prevent childhood lead poisoning by both preventing instances of childhood lead exposure and providing case management services to children who are lead poisoned. Next slide, please. So in our county, we have encountered multiple sources of lead, including imported spices such as turmeric and chili powder, paint, water, etc.
Let me.
But one source that has notably come to the forefront over the past few years is leaded aviation gas or leaded avgas. For those who may not be familiar with the fundamentals of aviation gas and its negative impacts, let me share a brief overview. So aviation gas is a fuel commonly used by small piston engine aircrafts and is the most widely used transportation lead containing fuel in the US. These are very small, and these aircrafts carry about 2 to 10 passengers. Piston engine aircraft is the largest single source of lead emissions to the air in the US, contributing 70% of the lead entering the air annually. These emissions cause elevated lead levels in the air near airports. When these lead air pollutants settle, they contaminate the neighborhoods around airports and can create soil and dust with levels of lead that are unsafe for children. But why is this a concern? Because there is no known safe level of lead in the body. Lead is a toxic metal and can be especially harmful to children as their bodies are still rapidly growing. Lead poisoning can lead to lifelong learning disabilities, behavioral problems, reproductive, heart, and other health problems. Next slide, please. So now I would like to discuss a study conducted in our county and also the subsequent outreach initiatives followed to promote awareness. The study is called Santa Clara Airport Study or Reed Hillview Study, Reed Hillview Emission Study. The Board of Supervisors commissioned a lead study in 2020 to find out whether there was any link between lead-based airplane emissions at Reed Hillview Airport and the blood lead levels of children living near that airport. The study analyzed primarily 3 factors: the blood lead levels of children within 1.5 miles of Reed Hillview Airport, and piston engine aircraft activity at that airport, and weather and prevailing winds for that study period. These 3 factors were analyzed to establish whether there is any significant relationship between the emissions and blood lead levels. Dr. Zoran and his team, they used 17,000 blood samples between 2011 and 2020. They collected these samples from the California Department of Public Health. And they collected the flight records from the Federal Aviation Administration and whether data was available for them from National Oceanic and Atmospheric Administration. That study concludes that under periods of high piston engine aircraft traffic, children proximate to Reed Hillview Airport experience an increase in blood lead levels on par with the children of Flint during Flint water crisis in Michigan. During times of maximum aircraft traffic, children within a half-mile of the airport had an increased blood lead level of 0.83 micrograms per deciliter, nearly twice that observed at the height of the Flint crisis. Next slide, please. So following that publication of the RHP study, the Board of Supervisors has voted to ban the sale of leaded fuel at both county-owned airports. One is Reed Hillview Airport and the other one is San Martin. That's beginning from March 2023. In fact, last week, the US Environmental Protection Agency officially determined that emissions from aircraft using leaded gasoline pose a public health threat. That is a major step toward a national ban on the fuel. If we look into the statistics, we will understand why it is so important to have a national ban on this fuel. Nationwide, an estimated 4 million people live within 500 meters of the 20,000 airports used by 170,000 piston engine aircraft that continue to use leaded aviation fuel. About 600 schools are located in that same close range. Approximately 16 million people, including 3 million children, live within a kilometer of such facilities. Failure to address this hazardous pollutant could result in adverse effects on children. As I said before, there is no known safe level of lead. Exposure to even a small amount of lead has a negative effect on cognitive ability and IQ, particularly in developing children who absorb lead more efficiently than adults. Next slide, please. The community actions taken by our program includes raising awareness of this lead source, promoting preventative measures, and advocating for blood lead testing, because that's the only way to know if a kid is lead poisoned. Next slide, please. The outreach was targeted to childcare providers, healthcare providers, parents, community organizations, etc., near airports. Social media posts and our website were also part of the promotional tools. Let's go into the details. Next slide, please. Yeah, next one. Yes. To start with, we have collaborated with a local organization called LUNA. It's Latinos United for a New America. In July 2022, LUNA and the county joined forces to take certain actions in their lead exposure campaign. Our team provided a brief overview about lead poisoning, harmful effects on children, sources, and safe practices to the staff and the volunteers. Last year, from July to October, along with a team of promoters, they did a door-to-door campaign. They visited 14,481 households within a 1.5-mile radius of the RHV airport by going door to door. In October to December last year, LUNA organized house meetings with community members to share the results of the study and provide information about lead exposure. From November 2022 to January 2023, LUNA prepared and invited community members to participate in an EPA public hearing concerning leaded aviation fuel and the associated 90-day public comment period. We also shared CDPH health education materials to them. Our team was there to assist them to address any questions raised by community members. For instance, one common question from the community was about the process of getting a blood test and what to discuss with the doctor. And community volunteers, there were some volunteers near that airport in a neighborhood called Kessel neighborhood. Those were the residents who were actively involved in raising awareness in the community. An article was published about lead prevention information in their community center newsletter, and it was distributed to 2,400 families. We provided them the information about lead poisoning, blood lead testing. And last year, actually a few months ago, they requested for more aviation gas flyers. I think we provided them about 600 to share within their neighborhood. Next slide, please. Presentations. In my role as a health education specialist, I regularly conduct presentations designed to provide a concise understanding of lead poisoning and prevention. In these presentations, we have integrated a couple of slides specifically addressing leaded aviation gas, shedding light on its adverse effects, safe handling practices, and underscoring the significance of regular blood lead testing. And our targeted, our involvement also extended to participating in a town hall meeting held at the community center near the San Martin neighborhood. During this event, residents expressed a keen interest in learning about aviation gas and providing us with an opportunity to explain the harmful effects of aviation gas. And we also distributed informative brochures to them. Our targeted outreach started with childcare providers. We have established a valuable partnership with Santa Clara County Office of Education, Catholic Charities, and First Five. That's how we got an opportunity to present at Head Start schools, family resource centers, other schools, and libraries located in the vicinity of that airport. Healthcare providers also received this information through a newsletter article. Grand rounds were organized for the providers at Valley Medical Center, Bay Area Community Health doctors, and also school health clinics. We also participated in tabling events at health centers to share and disseminate this knowledge. Next slide, please. Actually health fairs, we attended health fairs because that's the other way we chose to interact with general community members one-on-one. And we participated in health fairs in parks, libraries, and also at schools. To reach a wider audience, we used social media posts, and we also updated our CLIP web page with this information. Additionally, we ensured that the content was translated into Spanish, Vietnamese, and Chinese to cater to the needs of diverse language population. Next slide, please. So we distributed health education materials. The left side, you see a flyer. That is the flyer that we created from our county, including the aviation fuel as a lead source. This one, along with other CDPH brochures, were distributed in various locations, including community centers, women, infant, and children WIC sites, childcare centers, and libraries such as Hillview Branch Library, Santa Teresa, and Tully Library near Reed Hillview Airport. Additionally, there were some interactive sessions during story time or craft time at libraries, parent meetings where questions from parents were addressed. Next slide, please. I think that's about it. So as I mentioned earlier, our team not only engages in community outreach, but also offers case management services to children who have been exposed to lead. So furthermore, our public health nurse, public health assistant, and our environmental team, they also provide education to the parents of these children with whom they are working very closely. So those are the some of the initiatives we have undertaken to raise awareness about leaded aviation gas in our county. So I think now I'll pass the virtual microphone to Jessica, who will share the activities that were conducted in other jurisdictions. Thank you, everybody.
Thank you, Srilatha. And so now we're going to move into what other local health jurisdictions and the states are doing. So similar to Santa Clara's work, other CLPP programs in local health jurisdictions are providing information about leaded aviation gas across their communities. Many CLPPs are also targeting childcare providers, schools, and community centers located near airports for part of their targeted outreach. They're also incorporating messaging about the dangers of leaded aviation gas into their community-wide outreach to parents, childcare providers, and healthcare providers. Some CLPPs are working with their board of supervisors, local agencies, and nonprofit groups to reach even more people with educational information. And CLPPs in general provide one-on-one consultations. They give group presentations and participate in community events as part of their outreach strategy. They also send mass emails to community partners and submit articles to healthcare provider newsletters. Next slide, please. So now we'll move into the state's actions around leaded aviation gas. So as we at the state started to receive more questions about leaded aviation gas and how it affects children's health, CLPP is the state branch, developed an educational flyer and corresponding webpage with background information about the use of leaded aviation gas, why it is a health concern, and tips for preventing exposure. As with all of our messaging, the flyer encourages blood lead testing for any child who may be at risk of lead exposure. For the month of October and Lead Week specifically, we developed a new flyer outlining the multiple sources of lead air pollution, including shooting ranges, industrial sources, and construction, in addition to aviation gas. You can request printed copies of these flyers from your local CLPP program, or view and download them from our website, and I will provide contact information at the end of the presentation. Next slide, please. So the lead in aviation gas flyer has been available since the beginning of this year, and around 33,000 copies have been distributed to parents, childcare providers, schools, and local organizations across the state. And the lead air pollution flyers were just released this month, but over 7,000 have already been distributed. And as I mentioned earlier, outreach is being done in both the targeted areas around airports, as well as to the general public and local partners within communities across California. Next slide. So now we're going to talk about how families can stay safe and prevent exposure to lead. So areas within approximately a mile are the most at risk of lead air pollution from those small piston engine airplanes that still use leaded fuel. To help remove lead that may get into your indoor air at home, you can use an air purifier that has a HEPA filter. Some of the other sources of lead air pollution besides the small airplanes include industrial sources like battery recycling plants, pigment and glass makers, lead weights and solder manufacturers, shooting ranges, and construction and demolition sites. So if these buildings do not use proper air filters and containment methods, the lead emissions can escape the building and contaminate the surrounding neighborhood with lead. And while that lead is in the air, it can be breathed in. And then it also settles onto surfaces like the ground or outdoor furniture. And then children can get it on their hands and on their toys and accidentally swallow it when they put their hands or toys in their mouths. So next slide. So if you live in a neighborhood near a source of lead air pollution, there are several steps you can take to keep your family safe from lead. So lead can settle onto the soil from lead air pollution, as well as from other sources like the past use of lead fuel in cars, from chipping paint on older homes. And we all know that kids love to play in the dirt, but that can be dangerous if there is lead in the soil. So a simple way to fix this is to cover bare dirt with plants, grass, or another ground cover like gravel or bark. Another way to prevent children from lead exposure is to wash their hands frequently, especially after they've been playing outside, before eating, and before naps or bedtime. Lead in the air from deteriorating lead-based paint can end up as house dust, and children can easily get the dust on their hands and put their hands in their mouths, which is why we recommend cleaning up dust regularly. It's best to use a wet cloth or paper towel with an all-purpose cleanser to wipe surfaces and a wet mop to clean hard floors. Dry dusting or sweeping can just spread the lead dust around your home. And removing shoes before coming into the home is another easy way to keep lead dust outside. If you or someone in your home works with lead, such as construction, painting, demolition, battery recycling, metal recycling, or at a shooting range, it's best if they can shower and change out of work clothes before they get into their car and come home. If they cannot shower at work, they should change their clothes and shoes at work and put those in a bag and then shower as soon as they get home. Work clothes that have lead on them should be washed separately from the family's clothes. And next slide. So if you think your child might have been exposed to lead, talk to your child's healthcare provider about testing for lead. Even small amounts of lead can harm a child's health and development. Children with lead poisoning may not look or act sick. There are often no symptoms. So a blood test is the best way to learn if there is lead in your child's body. If the test shows that your child has more lead in their body than most children, then a public health nurse will reach out to you to help. And children enrolled in Medi-Cal and other publicly funded programs like WIC and CHDP are required to get a lead test at ages 1 and 2. And if they miss a test at 1 or 2, they should get a catch-up test up until age 6. And most health insurance plans will also cover the cost of the test for children who are not enrolled in Medi-Cal. And next slide. So today's presentation focused on lead in aviation gas and other sources of lead air pollution, but there are many sources of lead around us. Lead-based paint was used until it was restricted in 1978, so buildings built before 1978 are presumed to have lead-based paint. When the lead-based paint breaks down or starts to chip or crack, then it becomes a health risk. Lead can also be in water from pipes and faucets that use lead solder, brass, or are galvanized. Lead can also be in many consumer products, especially if they're imported or if family or friends bring them here from other countries. Some examples include spices like turmeric and chili, imported pottery and dishes that use lead glazes or paints, traditional or Ayurvedic remedies like greta, azarkan, and cultural powders and cosmetics like surma, kohl, and sindoor. So if you're interested in learning more about preventing lead poisoning or the work we do, you can visit our website. The URL is written out here, or if you want to take out your smartphone and scan the QR code with your camera, you can go ahead and do that. I'll pause for a moment to let you do that. All right, next slide. And if you have questions about sources of lead, how to keep your family safe from lead, or if you'd like to request educational resources, please reach out to your local childhood lead poisoning prevention program, such as the Santa Clara program we just heard about. The URL is here. It's a bit long, so again, I'd recommend scanning the QR code, and that will take you directly to the contact list for each local lead program throughout the state. You can also navigate to this page from our homepage that was linked in the previous slide. If your county does not have a designated lead program, you can also reach out to us at the state directly at pds@cdph.ca.gov. And next slide, please. So thank you so much for your time. I hope this presentation was educational. If you would like to reach out to either Srilatha at Santa Clara CLIP or myself at the state, our contact information is listed here. I'm going to go ahead and stop the recording and we'll move into answering questions. So please use the chat feature. We can also unmute you if you'd like to raise your hand to ask a question. Thank you.